Hello everyone. I would like to introduce you to the NF Network's webinar series. I'm Kim Bischoff, the Executive Director. These webinars have proven to be an excellent way for the NF Network to reach individuals across the country. This evening we're very fortunate to have Dr. Stacy Martin with us. She is from the National Institutes of Health, specifically the National Cancer Institute out of Bethesda, Maryland. Tonight we'll learn about her study on coping with chronic pain, which is a study that I have a particular interest in since my daughters just completed the study. Jackie is also with us tonight. She's with Captions Unlimited, and she's providing the captioning service for you on the side. Before we get started, I just want to give you a few details on how to make this a little bit more comfortable for you to use. So when we're going through the webinar tonight, if you should have a question, please click on that little plus button next to question and go ahead and type it in. Once Dr. Martin is finished with her presentation, I'll be able to read them out loud. If you have a question or an issue with being able to see something, type it in and I'll go ahead and get back to you as well. So if the webinar control panel is in your way and to see Dr. Martin's presentation, there's an orange rectangular button with an arrow on it. You can click on that and it'll move it away from the presentation. And now I'd like to introduce to you Dr. Stacy Martin. Welcome, Dr. Martin. Thanks for joining us tonight.
Thank you so much, Kim, for having me. I really appreciate this opportunity to talk about the work that I'm doing.
Well, we're looking forward. I know that Jenny really enjoyed it very much going through your study.
Oh, good. I'm glad to hear that. So I'm going to start talking about, I just want to give a really brief overview of what we know about pain in NF. And I imagine that a lot of the people who are tuning in tonight have some personal experience with this topic. But surprisingly, there's not very much written in the research literature about it. Some studies that have been done have shown that pain is reported in just over half of youth who have NF1 and plexiform neurofibromas. And for anyone who's not familiar with PNs, they're a type of tumor that grows along the nerves, and they are one of the primary causes of pain in NF1. Also in NF1, over half of youth, of children and adolescents, report that they have pain that's severe enough to interfere with their daily life. And that's even true among those taking pain medications. We don't have very much information about what pain is like for adults with NF1, although we know, I certainly know from personal experience, and probably all of you do as well, that it certainly can be an issue. There's just not very much written about it, unfortunately. What we know about schwannomatosis is that there are a lot of adults with schwannomatosis who report chronic pain, which is usually due to neurofibroma tumors. And there's really nothing out there on pain in NF2, and it may not be as prevalent as it is with NF1 and schwannomatosis, but I certainly have met some people with NF2 who tell me that pain is a big issue for them as well. And one thing that we feel is very important is that when we're talking to someone who has pain, it's important to ask them not just about their pain intensity or how severe their pain is, but also what we call pain interference, which is how much is that pain getting in the way of you living the life that you want to live. And I mention that because that's kind of an important premise to the type of treatment or psychological therapy that I do. And so I'll move into that now. What I am specializing in is a type of treatment called acceptance and commitment therapy. We call it ACT for short instead of ACT, and that's because the developers really wanted to emphasize the active nature of this type of treatment. There's a lot of literature about using ACT with different types of people that have chronic pain: arthritis, neuropathic pain, lower back pain, fibromyalgia, sickle cell, and a variety of others. And it's been found very effective with all of these types of individuals. I'll talk a little bit towards the end about the research that's being done with ACT with NF. And among all of the different types of therapies out there, the American Psychological Association has actually designated ACT as having strong research support for chronic pain, and it's the only type of psychological therapy to have that designation. And a few years ago, some researchers got together and looked across all the studies that have been done using ACT with people with chronic pain, and they found, kind of summarizing the results from all of those studies collectively, that it significantly improves pain intensity, so people are saying they have less pain. It also improves depression, anxiety, and quality of life. So what's different about ACT is that, unlike a lot of other traditional therapies, the goal is not to eliminate a person's pain, but to optimize their quality of life while living with the pain. And that can be a little bit difficult to wrap your head around. When someone comes into my office that I'm going to be working with who has chronic pain, you know, I tell them, well, my goal is actually not to get rid of your pain. Now, if I had the magic pill that I could give people to get rid of their pain, I would. But a lot of times the people that I meet with NF and other illnesses have done the medications, they've tried various techniques, they've been to lots of doctors, and nothing has worked to completely get rid of their pain. And so what I try to offer them as an ACT therapist is a way to live the best life they can live while they have this pain. So tonight I'm going to go through a few of the key concepts and techniques that we use in ACT. These are not all of them, and I'm certainly not thinking that, you know, when the webinar ends tonight, you guys will know everything there is to know and can just go off and use these techniques to solve all your problems related to pain. But this is just kind of a snapshot of what kinds of things we do in ACT. And then at the very end, I have some resources for people who are interested in either participating in research on ACT or you know, books, websites, smartphone apps, that kind of thing, if you're interested in learning more. So the key concepts that I'm going to be going over are mindfulness, willingness, and values. And I'm going to start with mindfulness. It's something that a lot of you may have heard about. There's a lot of things that have been written about and are talked about in the popular media. I think Oprah has talked about mindfulness, and there's mindfulness programs in schools, and so we definitely hear a lot about it. And mindfulness just means an awareness of the present moment, kind of noticing what's going on in our bodies and around us without reacting right away, impulsively. And so a lot of times people who practice mindfulness do so by meditating. Some people, you know, have the idea that to practice mindfulness, you have to just sit in a quiet room and meditate and chant and things like that. And that's just one of many, many ways to practice mindfulness. And it's not right for everybody. Some people just, you know, are not into meditating, and that's fine. There's so many other ways that you can integrate mindfulness into your daily routines. Pretty much anything that you do, you can do mindfully or mindlessly. The present moment is a really important concept in mindfulness because, you know, as human beings, we have this tendency to a lot of times be thinking about the past, you know, oh, what did I say the other day to that person? I can't remember. Or, you know, really, I shouldn't have done that yesterday. Or we're thinking about the future, you know, we're thinking about what we're going to cook for dinner tonight or that vacation that we're going to take next month. And sometimes it's necessary to think about those things, but we spend an awful lot of time there in the past and the future, and all of that time we're missing out on what's happening in the present moment. And so we try to teach people in ACT to become more mindful of everything in their daily lives. I have those pictures on the screen because you can pet your dog or cat mindfully or mindlessly. You know, I had someone just the other day with NF1 tell me that one of the things that she does when she's stressed out is she just goes and pets her dog. And when she's petting her dog, she is in the moment. She is focusing on how good it feels to pet her dog, and you know, just how good it feels to get that affection from her animal. You can brush your teeth mindfully. Most of us probably, when we brush our teeth, we're doing so not really thinking about brushing our teeth, you know, but you should try this sometime. Try it tonight or tomorrow morning. Is just when you go to brush your teeth, really notice the taste of the toothpaste and how the bristles feel on your gums, and just notice as much as you can out of that experience and just see if it isn't any different. Maybe not better, maybe not worse, but just a little bit different. You can wash the dishes mindfully. You can have a conversation mindfully. One of the things that I talk to, I work with a lot of kids, and one of the things I talk to their parents about is mindful parenting. There are really good books written on this topic. If anyone who's listening is a parent, and I think I have some of those listed towards the end, but there's a big impact that we can have on our relationship with our kids when we are mindful with them. Being really tuned in to what they're expressing, what they're saying, what they're feeling, that is really powerful for both the parents and the kids, you know. Sometimes I take my kids sometimes to a play area, like at the mall or a playground, and sometimes I see kids who, you know, get up on top of the jungle gym and jump off, and they're looking at their parent when they jump down as if to, you know, get praised, and see their parent smiling at them, and their parent is often, you know, just off in another world and on their cell phone or talking to someone next to them, and so, you know, really being tuned in to what's happening is important for both the kids and the parents. This shows what is not being mindful, what I call mindlessness. Now, I love my iPhone as much as the next person, but I have to remind myself a lot sometimes to just put the phone away and really be with the person that I'm with, really tune into them. And you have a very different experience when you're interacting with people when you do this. I love that picture of the woman, the mom who's just standing there on her phone while her kids are just sitting there in the swings, not moving at all. So one more thing about mindful parenting, and then I will get into how this relates to pain, I promise. But there's the story about a family that was at a restaurant, at a diner one night, and the waitress came up to take their orders, and the mom and the dad ordered. And then the waitress looked at the little girl and said, "And what would you like?" And she said, "I would like a hot dog, applesauce, and lemonade." And the dad looked at the waitress and said, "She will have the baked chicken, the broccoli, and milk." And the waitress looks at the little girl and says, "So what do you want on your hot dog, honey?" And I love that story. And actually, and the way that it ends is that, you know, the parents are kind of stunned, thinking, you know, what just happened here? And the waitress walked away, and the girl looked at her parents with this expression of awe on her face and said, "She thinks I'm real." And I love that because it just shows you how when you're tuned in to the child and what the child wants and needs, you can really have a very different experience, and it's very powerful for those kids. I'm not saying you should always let your kid have whatever they want to eat, but it's just a good example of how powerful it can be when you're interacting with someone mindfully. So there's a famous experiment in psychology that was done back in the 1970s. It's called the Good Samaritan experiment. It was done at Princeton with students who were studying to be in the ministry. And the way they did the experiment was to have half of the participants, these seminary students, tell them that they were going to have to give a talk on the Good Samaritan study from the Bible, which is about, you know, just being a good person and helping your fellow person. And then the other half of the students, they said, you're going to give a talk on what it means to work in the seminary, kind of a generic topic. And they said, you have to go to another building in a little while to give that talk. So we'll give you a few minutes to get ready and prepare what you're going to say. Well then, when they walked to this other building, everyone passed by a confederate, which in psychology it means an actor who is part of the study team. And this confederate was sitting on the sidewalk, just visibly distressed and upset, in tears. And the question that the researchers asked was, who would stop? Would the people who had just focused on the Good Samaritan story stop and help, whereas the people who didn't wouldn't? That was their hypothesis. But they actually found something different. What they found was that what made a difference in terms of whether or not someone stopped to help was if they were told that they had to hurry to get to the other building to give their talk or not. Some people were told, oh my gosh, you're going to be late, you have to get there now. And those people were much less likely to stop. Whereas other people were just told, okay, it's time to go to your talk now. And they stopped to help. And so I think the meaning of that for me is so often we are just not tuned in to what's going on around us. You know, it's very likely that the people who didn't stop, they're not bad people, right? It's just that they were not tuned in to what was going on around them. They were so preoccupied. And I feel like today, people are always rushing, myself included. And mindfulness has a way of really bringing us back to the present moment, and even just focusing on your breathing. I mean, that's something we do all the time, right? We're always breathing. And so just focusing on our breathing as we breathe in and breathe out is really helpful in tuning us in to what's going on inside of us and around us. So the way that we use mindfulness in ACT when we're working with people with pain is to kind of help the person create some distance between them and their thoughts about their pain by reminding them that the thoughts we have are just thoughts. Words are just words. For example, I have a lot of people with pain who say things like, you know, when I hurt a lot, when my pain gets bad, I have to go lie down. I have to go to bed. Or I have to go take my pain medication right away. But a lot of times there's really no space between having that thought and doing that behavior. It just becomes such a habit that they don't ever really stop to think about if that's what's best in that moment. And so there may be times when the pain is getting worse, and there may be other things that are more important to do at the time, things of value to that person, right? Like, yeah, I'm really, really starting to hurt, but I really need to help my kid with his homework before I go to bed, because that's really important, you know, being there for my child. Or I really have to get this report done for work, or I really have to call my sister because it's her birthday. Those are things that are important to that person. And so if you can create a little bit of space between having that thought, I have to go to bed or I have to take my pain medication, and actually doing the behavior, there's a lot of room in there where other things can happen. There's a lot of possibilities for other options. Now, it may be that in some situations, the best thing to do in that moment is to go and rest or to go take a pain pill. But I want people to choose that because it's what's best for them at the time. It's related to what they care about. So maybe the best thing to do is to go and to just go to bed early, because that way you know that you're going to be able to get up early and be ready for that important appointment that you have first thing in the morning. But the difference is you're making the choice then based on what's important to you, not just based on the pain. And in that way, you're not being controlled by the pain anymore. You're being controlled by, you're making choices based on your values. And we're going to talk more about values because that was one of the other components of ACT. So the research that's been done on mindfulness and pain is pretty compelling. One study that I'll mention is one where researchers trained people in mindful meditation 20 minutes a day for 4 days in a row. And then what they did is, well, they trained half of the participants and the other half got no training. And then they brought people together and they subjected them to an unpleasant heat stimulus. So it was painful. It wasn't horribly painful, but it was painful. And they instructed the people who had learned to meditate. They said, we want you to do that mindful meditation while we're giving you this heat stimulus. And the other people were told just to relax. The people who used the mindful meditation reported that they were in less pain. They rated their pain lower. They reported that the pain was less unpleasant. They weren't as bothered by it. And they actually had increased activation in parts of the brain that modulate pain. So this isn't just something that they're doing behaviorally. This is actually working on a physiological level in people's brains. And there are quite a lot of other studies that show that after extended mindfulness practice, people who are trained mindfulness practitioners have changes in the brain that occur over time. So that's really exciting. I think the most exciting thing out of some of this research is that mindfulness actually changes the brain. That's pretty powerful to me. One other thing that I like to mention in terms of mindfulness is yoga. Yoga is a very mindful practice. It really encourages people to focus on the present moment while they're doing the yoga poses. And I mention yoga in particular because it helps with pain in both adults and kids. People say that when they do yoga, it reduces their pain. In a study with kids that I have here, they taught kids 10 yoga lessons, and they were reporting significantly less pain, and the parents were reporting better quality of life in their kids after those 10 yoga lessons. Those are all kids and adults with chronic pain. And the other reason that I like to bring up yoga with people with NF is that sometimes it's hard for individuals who have painful tumors or other pain related to NF to engage in more strenuous exercise. I have lots of teenagers who say, I really want to be out there playing soccer or football or, skateboarding or things like that, but I can't. And so this is a way, it's one option for people who may not be able to do more strenuous activity. And it promotes mindfulness, so that's another benefit. In case those of you who are listening are thinking, yeah, but my husband or my son won't do yoga, this is just to remind everyone that real men do yoga too. Just want to put that little plug out there. So now I'm going to get into the second component of ACT that I'm going to be talking about, which is willingness. And what we mean by willingness is just acknowledging that your current situation is true. You may not like it. You may not like the fact that you have chronic pain or that you have NF. But just are you willing to acknowledge that it is true in this moment? Now, we give questionnaires on willingness that measure that concept, and I thought it's often helpful to read some of these items because I think it gives a good idea of what we mean by willingness. So for the questionnaire that we give to people with NF, one of the items is keeping my pain under control is the most important thing whenever I'm doing something. And so that person would score low on willingness because the meaning behind that is basically my pain is in control. My pain is in the driver's seat. That's the most important thing that I have to keep in mind, is getting my pain under control. Now the next item is when my pain increases, I can still do things I have to do. That would be endorsed by someone who was high on willingness. There's a parent version of that questionnaire that we give as well. And so one of the items is symptom control must come first whenever my child does anything. Again, that would be low on willingness because the pain is in the driver's seat. Getting rid of the pain is the #1 priority and the only thing that matters. Someone scoring high on willingness might agree with the statement, it is possible for my child to live a normal life even though they have this chronic illness. So why is willingness so important? Why do we focus on it in ACT? Well, research has shown that people who are high in willingness have experienced less pain, have lower pain-related impairment, and they're less anxious about their pain. There was also a study with women in breast cancer that showed that willingness was related to less depression and distress. And for this study, what they did is they had women who were diagnosed with breast cancer come in and give a 10-minute presentation just on their experience with the disease. And they audio taped those presentations, and then they went back, the researchers went back and looked for themes in the content of those presentations. And what they found was that there was a lot of people who had this kind of acknowledgement or willingness theme in their statements. One of the statements was, I think that right now it would be good for me to work with acknowledging the feelings about what is in my life right now. So that's one that's more willing, shows more willingness. Another statement was, I simply tried not to think about my illness and I occupied myself with other things that might get me to focus on something else, like cleaning the house. So that's more of an avoidance theme. You're trying not to think about it. And what they found was that people who had more of that willingness theme in what they talked about were less depressed and less distressed. I often use the metaphor of a beach ball when people say, I just need to keep my mind off of it. I just need to, not be depressed or not be in pain and not have that thought. And what I say is that, okay, so if your thought is a beach ball, you can hold it underwater. You can get rid of it. You can put it under the water and keep it there for a while, but you can't do anything else. You can't really swim. You can't play and splash around while all of your energy is invested into getting rid of the pain or the thought about the pain. If you just kind of let the beach ball float around you, not trying to get rid of it, it's still there, but then you can have fun. You can splash around and play and swim. So I kind of like that metaphor. The third component of ACT that I'm going to be talking about is values, and I've alluded to this in some of the things that I've already said. In ACT, values does not refer to morals or ethics. It refers to who or what is important to you. And I like to get a good sense of that from the people that I work with. Usually some of the common ones are my family, my friends, my significant other, maybe education, art, dancing, sports, gardening, playing with my pet, things like that. And what we want to do is try to increase the person's focus, put more of that energy into the person's values. So instead of just holding down that beach ball all the time, they can free up their energy to put into other things that are really important. So for example, this is the Bullseye Tool. This is something that we use in ACT a lot to kind of visually demonstrate what we're talking about and what we try to do. So for example, someone who says that one of their values is education. We might take out this bullseye picture and ask the person to put an X on this picture, on this image, to show where they are in their life right now when it comes to education. So someone who says, gosh, I really wish that I could go back to school and finish my degree, but I'm not doing anything about it right now. They might put their X kind of way out to the side there. And what we try to do in ACT is not all of a sudden go for a leap right into the center of that bullseye, but instead we might just do little steps that's going to get that X a little bit closer to the center. So for example, I might ask, well, what's one thing that you could do in the next 2 or 3 days that would move you just a teensy bit closer to the center? And they might say, well, I could go online and look at the class schedule for next semester. And that's the start. It's just one little shift towards the center of where that person wants to be. And so to kind of give a bigger picture, I'm really not that good at doing these images on the computer, but hopefully you'll get the idea. If you look at the red circles in the middle, what I do is I ask people which red circle looks bigger. And for those of you who are very keen observers, you might know that they're actually the same size, but the optical illusion is meant to convince people that the circle on the left that's surrounded by the small circles is actually bigger. It looks bigger by comparison. And the one on the right looks smaller. At least that's the way it's supposed to be. So humor me on this one if it doesn't really look that way. And so the red circles, as you can see, represent pain. And the circles that are around the outside represent values. What a lot of people tell me when I first start working with them is that they relate more to the circles on the left. That pain is like the biggest thing in their life. It is always there. They're almost always thinking about it, how to get rid of it, how to prevent it from coming back and getting worse. When is it going to come again? When is it going to get bad? It's just always front and center in their lives every day. And so what I'm doing with the people that I work with is to try to get them to not make the pain any smaller. Remember, I started out by saying that my goal is not to shrink your pain. My goal is to expand those other circles that represent your values. Because if I can get you relating more to the circles that are on the right and saying, wow, all these things that are important to me, now I'm really focusing a lot on them. What happens is that pain looks smaller by comparison. It doesn't take up as much space or energy in the person's daily life. Now, I have to have realistic goals, obviously. I'm not going to tell someone who loves dancing to go out and do, Zumba every single night. We have to balance out what is physically possible and realistic. And so we do want to keep the goals realistic. And again, not leap too quick into, making radical changes. Just little steps can make a big difference in the end. So my students, I direct the training program in our psychology group, and my students often say, well, how do you know that this is working? How do you know that it's effective? And the answer to that to me is that sometimes I'll have a student work with a patient, someone who has chronic pain, and they'll work with them week after week. And, in the beginning, it's all about their distress, about their pain. and coping with the pain and the anxiety and the depression and so forth. It's all tied up in the pain. And after a while, what usually happens is that the student will come in for supervision and they'll say, oh, I met with this person last week and here's what we talked about and here's how things are going. And I'll say at the end, well, what about their pain? And the student will pause and say, you know, she never mentioned that. That's how I know it's working. Now that person is just dealing with other problems in their life. They're not consumed with pain. They can really focus on the things that are important to them. Not that their problems are all going to be solved, but the pain is not going to be in the driver's seat anymore. That's what we're going for. So now I'll mention some of the research that we're doing using ACT with people with NF1 and chronic pain. Our clinic at the NIH is pretty much exclusively NF1. We don't really work with people with NF2 or schwannomatosis, unfortunately. And it is a pediatric clinic, so most of our population is from young kids through adults in their mid-30s. What we did a few years back was a small pilot study because there wasn't any research out there on using ACT with people with NF1. And so we did this pilot study where people came to the NIH for a 2-day ACT workshop. We had people complete some questionnaires asking about their pain and how much pain interfered with their life and so forth. They did those before the workshop. And then they took those questionnaires again 3 months later. Now, in terms of our results, we had 12 families go through the workshop. 10 adolescents and 6 of their parents returned their follow-up questionnaires. And even with that small sample size, and I'm sorry, let me back up. The participants were an average age of about 17. They ranged from 12 to 20. We had 4 males and 6 females, and we had a variety of levels of disease severity. We asked people to rate how severe their NF1 was, and we really had people who were both mild, moderate, and severe. All of them had plexiform neurofibromas. That wasn't a requirement of the study. That's just how it worked out. Most of our population at the NIH do have plexiforms. So what we found is that even with our small sample size, we did see a significant reduction in how much pain was interfering with the patient's lives. And that was both by patient report and parent report. The adolescents also rated their actual pain intensity as lower at the 3-month time point. Again, that's not a target of ACT, right? We don't say that your pain is going to get less, but that may happen just because people are more focused on other things. That's our goal, at least. And we also measured willingness with the items that I mentioned before, the questionnaire that I referred to earlier. We didn't see a whole lot of movement in the adolescents on willingness, but we did see an increase in the parents. And so basically what that means to me is that through the workshop and the exercises and the ACT techniques that the parents were learning, they were more able to accept and acknowledge their child's pain, even though, gosh, that's one of the hardest things to do as a parent, right? When your child's in pain, no parent wants that. But by acknowledging it and being willing for that to happen, the parents were then able to refocus more of their energy on supporting their kids in their goals, you know, helping their kids do the things that were important to them. So that was encouraging as well. So we concluded from that small study that ACT might be a feasible option to supplement or even replace pain medication in individuals with NF1 and chronic pain. Now, we don't try to encourage people not to take pain medication. I want to be clear about that. For some people, if it helps, you know, we say that is just fine with us. We do have some people who have reported that they feel like they need less pain medication after the intervention. We also thought that ACT may help parents of children with NF cope with their child's condition. But we wanted to really do more. We wanted to do a bigger study. to explore these questions more in depth. We'd like to see more research using ACT with other age groups, going beyond just the 12 to 20, and studies with individuals with NF2 and schwannomatosis as well could be helpful. So we were able to take that data, the results from our small pilot study, and apply for a grant to do a bigger study. And so the study that we're doing now is an acceptance and commitment training intervention for adolescents and young adults who have NF1 and plexiform neurofibromas. The reason that we include PNs as one of the eligibility criteria is because the foundation that is funding us is focused specifically on finding treatments for people with PNs. The other eligibility criteria are that you have to be between 16 and 34 years of age and have had chronic pain for at least 3 months. So people who are enrolling on this study come to the NIH for a 2-day visit. We have them complete baseline questionnaires. We have them get an EKG, which is an electrocardiogram, which many of you may know about, but for those of you who don't, it's a very quick, painless procedure that monitors heart rate. And then they do two 2-hour sessions with an ACT trainer, and where we teach them a lot of the techniques. We work on specific goals that are, individualized for each person, talk about ways of integrating mindfulness and all those other techniques into their lives at home. And then there's an at-home component to the intervention. For 8 weeks, every week, participants get an email from their trainer that has a new topic or a new kind of assignment, something new to practice that week. Every other week during those 8 weeks, we have video chats, 20 or 30-minute video chats, so that the trainers can kind of check in with people, see how they're progressing towards their goals, give them encouragement and support. And then at around that 8-week time point, they come back to the NIH for follow-up evaluations, and that's just a 1-day visit. And then 6 months later, we email the participants the same questionnaires to complete one last time on their home computer. Now, the study is randomized, and this is an important point. That's when, for any of you who might have ever done a randomized study before, there's 2 groups to the study. Sometimes people are randomized to get a treatment or a placebo. In this case, everybody is going to get the ACT intervention, but you will be randomized to either get it right away or to come back in 6 to 10 weeks and get the intervention then. And that's so when researchers do a randomized study, you can compare the waitlist group to the group that gets the intervention right away, and that's a really powerful statistical analysis to really show the effects of the treatment. The expenses to come to the NIH and lodging when you're here are paid for by our grant. So we fly you out and put you up in the inn on campus or at a nearby hotel. We also pay people $30 every time they complete the questionnaires. I do have the contact information for my co-investigator on the study who does the screenings, the eligibility screening. So for anyone who's listening who is interested in finding out more about the study, feel free to email Taryn Allen or call her at the number there, and she can answer all of your questions and tell you more about what's involved, and if you're interested, she can screen you to make sure you're eligible, and we can get you signed up. We are full through April, but we're starting to schedule people for May and the summer months. So we're really excited about this study. We've enrolled about 15 people so far, and we have a number more to go. Our target is about 80, so we're going to be doing a lot of this work over the next year or so. For people who are not able to come to the study or who are not eligible, I wanted to provide some resources. If you are interested in learning more about ACT, there are some apps, and with both ACT and Mindfulness. These are some of the ones that I like and that I've heard good things about when I recommend them to people. Some people come back after they've done, the ACT training, and they say, well, the one thing that I still do every day is this app. I really like the app. So these are some of them that you might want to look into if you're interested. I have some websites listed there that have more information about ACT and mindfulness. The Happiness Trap, that top one, is also a book. It's a really good book on ACT that I highly recommend, by Russ Harris. And it's just very easy to read. It has a lot of really practical information. It doesn't read like a textbook at all. It's just very, very easy to read. And then the fourth website at the bottom, contextualscience.org, if you go to that website, that is the website of the ACT organization, which is called the Association for Contextual Behavioral Science, or ACBS. That's a bit of a mouthful. But if you go to that website, there's a button you can click on that says Find a Therapist, and you can put in your zip code, and it can tell you if there are any mental health practitioners in your region who do ACT. So that's another option for people if you're interested. And then just a couple of books. The Full Catastrophe Living book by Jon Kabat-Zinn is really good. Jon Kabat-Zinn, for those of you who, some of you may have heard of him, he is basically considered the father of modern day mindfulness. And he has a big program in Massachusetts. His type of therapy is called MBSR. It's mindfulness-based stress reduction. And it's very well known. He has written tons of articles and books on this program that he developed. And it's used often by people with chronic pain. They go to this program and do this type of therapy. And it's very, very in line with the ACT. It's not exactly ACT, but it's very consistent with ACT ideas. And so that book is great. It's really geared towards people who don't go and do the program in person, but they want to learn about all of the skills and techniques that are taught. And then the second book by Steve Hayes is Get Out of Your Mind and Into Your Life. And Steve Hayes is basically the developer of ACT. And so that's a really good practical book for people who are interested in practicing some of the techniques on their own. And then I just want to mention the people in my psychology group help with the ACT research, and the NF medical team led by Dr. Brigitte Wiedemann at the NIH. And I thought for my last slide I'd show you a picture of my values. And I also have my contact information there as well. If anyone has any questions about anything at a later time, feel free to email or give me a call. And that's all I have.
Well, thank you so very much, Dr. Martin. What a great presentation tonight. Wonderful information for those of us that have NF, and even those of us who don't have NF. Tonight, the skills, we all deal with pain, and I'm sure this could be applied to anxiety and other issues as well.
It is very widely applied, and there's a lot of research out there, and a lot of people do this work with people with, depression, anxiety, all kinds of issues. So yeah, it's very generalizable.
I can see uses for it across the board. Everybody a chance to see if there were any questions, so I'll ask one first so that they have an opportunity to type here if they want to. One of the things that you had mentioned a little bit earlier about is that mindfulness can make changes in the brain. Mm-hmm. There was a certain age, like if you were a parent, is it more important to practice this with your child, or is this the same at any stage? As an adult practicing mindfulness, does it change the brain at the same intensity?
So a lot of the studies that have been done have been with adults. And in fact, they've even done some studies with older adults who have cognitive difficulties relating to aging, Alzheimer's, things like that. And they still find benefits to it. I don't know that I can say for sure whether the changes in the brain are identical or stronger or a little bit less intense, but But, you know, if you're an adult, you can still benefit from it for sure. I do like to recommend that people teach it to their kids because they're habits, you know, it's a practice. It's something you can do every day. And when kids get into the habit of thinking this way, of noticing their thoughts, of being able to calm down a little bit and get some distance between their thoughts and behaviors, those are really important skills for kids to learn. And so the earlier you can teach it to them, the better. People laugh at me because when my kids are getting upset, I sometimes will talk to them like, okay, well, let's focus on your breathing for a minute, or I'll take their hand and I'll just kind of stroke their hand and say, just focus on the feeling of my fingers on your hand, and just know that right now your amygdala is going crazy in there, you know. And so let's take some deep breathing because, you know, as you breathe slowly, your amygdala actually does calm down. It becomes less active, and so they'll know, yeah, Mom, yeah, my amygdala is acting up, you know. So
that's wonderful. I see your little girl in there has a broken arm. I hope that that's well now and she's healed.
Yes, that was last summer. She fell at summer camp last year. Yeah, she's all better.
Oh, good. Glad to hear it.
Yeah.
A lot of resources that have been put into the presentation tonight. So I know all of you who are attending are probably very anxious to be able to see these slides. If you weren't able to take all the notes down. So this will be published and put on the NF Network website, and it will be under, Kelly, fill me in, what's the name of that tab where they find webinars? So you go to the nfnetwork.org, then go to Understanding NF, and then Webinars, and you'll be able to access this. So it'll have the captioning on there, the sound, and all of Dr. Martin's slides, which include all those great resources. So I don't have any questions listed here now, Dr. Martin, so what I would like to do is just make sure, let everybody know that tomorrow sometime this will be posted on the website so that you can get back to it and get the resources that she's given us tonight. And then to say a great big thank you for giving up your time this evening, Dr. Martin, away from your children, your values, help all of us this evening. It's a great resource. I know that I will look at this webinar again myself.
Oh, good. I'm glad. Well, this is also one of my values, is to share this work and these resources and techniques with as many people as I can who might benefit from it. So I'm very glad to have had this chance to do that.
Well, thank you very much, and I'd like to say good night to everybody.
Okay, good night. Thank you, Kim.
Thank you. Bye-bye.
Bye.